Pleasure to be here today. I want to do a couple of things. First is disclaimers. I am not a clinician. I'm not a politician. I'm not an economist. I'm just here to share our story. I've got many colleagues here. They could share this story with you. I hope they do. But I think this has been a journey. It's not what we've done. It's something that we're doing. It's a work in progress. But I think to understand, what we're doing, I need to kind of set this up and share with you why we went down this path. And I hope this resonates with many of you. Hopefully it validates either a hunch or a path that you're on, or perhaps sparks you to actually take up this cause. Because I think this is the way out. I think this is the way forward, is building community health. So with that as a setup, I always like quotes, okay? And in our organization, we try to meet twice a year in a formal fashion with our employees through an all-staff meeting. And frequently I get, when are things going to calm down? When are things going to settle down? If you like change, this is just a wonderful time to be in healthcare. But a lot of people like it the way it was. They like things to settle down. So we try to get out in front of that, and we talk about things are going to continue to be turned upside down a little bit. And we got to get comfortable with that. Let's confront that on the front end. And I will tell you this, despite the frustrations that we might have in Washington, the concerns about recession, the depression, I still believe we have the highest calling in healthcare. We have the best profession, and I truly believe our best days are in front of us. So I just want to set that as a context. Now here's a question for you. This is, as I talked about, we asked our employees twice a year. And I'm not out to bash politicians. I think those are tough jobs, but we're trying to lead our employees down a certain path to a certain spot. And I would guess that if you talk to your employees, you'll get similar feedback, okay? We have a Republican governor, a Democratic president. It doesn't matter what your politics are, okay? There's a lot of frustration. Now, we asked this question. This is over 9 months ago, excuse me, almost a year ago. Okay. Since then, you may have heard, in February, our Republican governor stripped a lot of collective bargaining rights away from employees. And then we had this summer in Washington, we had the debt ceiling gridlock, which was then resolved in subsequent spending, and the Gang of 12 are going to tell us what the cuts are going to be for us. So the point is, let's not look to our state capitals or Washington, D.C. to solve this. Okay? Let's look from within, because I think there are a lot of good answers for us. Okay? So as we started looking for potential models, we hooked up with the triple aim. This is the triple aim: improve population health, improve the experience of care, and reduce per capita costs. Okay? Don Berwick, head of IHI, some of you are familiar. He's now subsequently become the administrator of the Center for Medicare and Medicaid Services. You're hearing more and more about the triple aim. Okay? What intrigued me was this notion of improving population health. How do we engage the consumer? Okay? So I look at the triple aim: cover more people, spend less money, get a better outcome. Okay? Here's a quote. I would point you to the American Hospital Association. It's a pretty fresh study in terms of our role. You know what, guys? We got to own this. This is our issue. Okay? Don't look to your manufacturers or your service industries in the community. Look to them to help solve it. But if we really want to get behind this notion of improving health in our communities, we've got to own this. We've got to lead. I would, again, encourage you. It's a quick read. You'll get good ideas about why, the promise of focusing on health, and you'll get some very concrete strategies. So why focus on this? Why are we going down this path? Again, this is our story. I'm not selling you anything. Many of you are doing some of these things. I would encourage you to go further and faster. But this is what we know. This is evidence-based. This is a pie-shaped chart. These are the things that determine your health status. Okay? 40%, lifestyles and behavior, what you smoke, eat, drink, how much you exercise or how little you do those things. 30% is your genetics. Can't pick your parents. 15 or 20% is social economic status, your education, your income. You in a single parent family? Are you caring for someone else in your home? Only 10% of your health status is determined by the medical delivery system. Okay, so think doctors and hospitals. That's the industry we all are in, okay? Not a very good return, okay? So we said, we've got to get beyond this 10%. We're not going to mess with the 30% of genetics. There's others who are working on that. I think there's great promise, but what can we as a community hospital, how do we get about 70% of this in play? So we came up to go a little bit deeper. There's this notion, very simple concept, the difference between health and healthcare. So I like to say, today I'm in the healthcare business, tomorrow I want to be in the health business, okay? So we focus on health, we lessen the need for healthcare. Okay? And I think this is just, this is kind of fundamental to where we're trying to take our organization, setting ourselves up, as I share with you in a little bit, you know, specifically what we're trying to do. Okay, now let me go back. Sometimes I get asked the question from employees, well, if we get really good at this, aren't you going to put us out of business? Well, I don't think so. You know, just because I say it doesn't make it so. You still need to access health care to maintain your health. We still want to replace hips and knees. We want to maintain an active lifestyle for people. But I want to share with you that this whole notion, are we going to put ourselves out of business? I don't think so, not anytime soon. I'm going to kind of roll through these pretty quick. This is from the Center for Disease Control, the obesity issue that we all probably have going on in our community. This is 1985. I'm going to roll through this. If you go to the Center for Disease Control, this will roll through on a nice quick montage. But the blue states, the white states, no data reported. Just wasn't even an issue. The light blue, 10%, and the little darker shade of blue, less than 15%. 1985, 25 years ago, the worst states in the country had less than 15% obesity. So we'll go darker, worse, 2000. See, there's Colorado. Come on, Colorado, hang in there. Oh, Colorado. Look at, but you see, in 25 years, we went from no state being worse than 15% obesity to now the best states are at 20%, and some are above 30%, okay? It's a problem, okay? So we're not going to go out of business anytime soon, okay? But you know what? I think these numbers can get worse, okay? But what gives me hope and the promise is I think we can reverse it in less than 25 years, okay? If you get personal, not to get personal, but I think this is sometimes, people, is he talking to me? Obesity, it's just, there's a high percentage of obesity in our country. We've got to do something about it. Childhood obesity, there's so many diseases that come with it, diabetes, congestive heart failure, coronary artery disease. We spend way too much money. It's treatable, manageable, and curable. Okay, so I think some of the problems in the system, the way it's been set up, it's a react and respond. I need to give Neil Patterson credit for this. This is his quote, so if I'd have been really good, I'd have had his name up there. I don't know, maybe he stole it from someone else, but that's for him to divulge. It's a react and a respond. You go to a doctor's office, they see you, write a script, you show up on an ER, we do a procedure. It needs to evolve into a predict and prevent. Much of the disease process, especially the lifestyle-driven illness, to distinguish it from, say, Parkinson's, Alzheimer's, select cancers. But the lifestyle-driven illness is what I think we as an industry have to get our arms around. Okay, so just to keep driving this home a little bit and setting you up in where we're trying to lead our organization, today we're in this upside-down pyramid. Focus, most of that's at 10%, where we spend so much of our resource. Chronic disease management. Then we spend some money, we're getting a little bit better on early detection and health and wellness. These are not new concepts. They've been around for 20, 30 years, okay? But they tended to be the last dollars we spent, not the first dollars we spent, okay? So I think in the future, where we're trying to lead our organization, our employees, is to flip the pyramid. Spend more money on health and wellness, okay? Early detection, so as we focus on health, there's less of a need for health care, right? Okay? Now, just to drop anchor on this a little bit, I'll make some points, and I'm kind of making them just to make a point. You can challenge me on any of this stuff. It's just our ideas. But I think it's the future. I think we've got to focus on health, okay? So much of the, it's why are we treating disease? Why don't we try to prevent it? I think we can get a full frontal assault on this. As healthcare providers, as industry leaders, we can make a difference. Because you know what? I don't think we're going to get there through Six Sigma, okay? Because some of the problems I see with that is you can do everything perfect, very efficient, very effective, and still lose a ton of money because of the payer source or the lack thereof, okay? And we do continuous quality improvement. I'm not being negative about this one, but I think it's got to be a much larger context. Rather than trying to reduce central line infection rates, I think the better question is, what are we doing to keep somebody out of the hospital so that they don't get a central line infection? We focus so much on reducing our length of stay from, say, 3.25 to 3.15, and that has significant economic impact. Again, the same question. What are we doing to keep somebody out of the hospital so that they don't become a statistic for a central line or an admission, length of stay? Now, the other thing I'll talk about on this is some of the other things that we do in our industry. Patient satisfaction. Okay, how many of you are chasing the patient satisfaction unicorn? Okay, what do I mean by that? Patient sat, very important to us. I get it, I understand. HCAHPS, annual provider updates, but we spend a lot of time, effort, in industry. And some of you have caught the patient satisfaction unicorn. We're all chasing this 99th percentile of satisfaction. Some of you have caught it, right? And the belief is that somehow our patients will be dancing and prancing and they'll be so happy with they'll gladly pay the rates for their insurance. The payers will gladly pay it. But I don't think that's the case. Okay? I understand we have these regulatory requirements that we have to comply with, but it's not going to get us there. We're tweaking the existing broken system. Okay? And I just think that we've got to do something different. We've got to engage the consumer to be more accountable for their care. Okay? Go smoke, eat, drink, do whatever you want, we'll fix you. And for the most part, we do that, and we do that very well across this country. But it's an unsustainable model. We can't fund it anymore. Got gridlock, it's not going to get solved in Washington. We're in this 2-year cycle of whoever the party that's in majority is going to get voted out, and the other party will take control but not have enough votes to get anything done. It's not going to get solved there, okay? And whatever they pass, we'll comply with that. I don't have any problem with that. But we're going to try to figure out a way to focus on health and engage our consumer. I think that's the way out, okay? And the last point I would say, people want to get healthy, okay? There is not a person in this room that doesn't want to get healthy. Consumers, people, there's a lot, we just got to align the incentive. So I'll ask for $1 million tax-free, $1 million tax-free, and I'll give you a year to do this. Will you get your BMI where it needs to be? Will you get your cholesterol level where it needs to be? Your blood pressure? Most of you would say, yeah. Will you do it for $100,000? Will you do it for $1? No, you're not going to do it for $1, but you'll do it for $1 million, okay? And I got some colleagues here. Don't worry, guys, I'm not going to give you $1 million to do this. But my point is, you align the incentives. It's not a question of can you do it, will you do it, do you have the desire to do it? It's all about the incentive, right? So will you do it for $100,000? Probably. Would you do it for $10,000? Probably. $5,000? Well, now we're starting to get to some price points where we're paying more for people to be overweight, to manage their diabetes, to manage their blood pressure. Let's try something different. We know what doesn't work, okay? And if we've just determined that incentives do work, I think we got to think differently about this. Okay? I mean, I know what doesn't work. We all know collectively what doesn't work. But maybe we ought to pay people to lose weight. $50 a pound, $100 a pound, 50 pounds, that's $5,000. Can I afford to do that? I don't know. I'm really trying to figure out, can I afford to not do it? $5,000 if I can get somebody off blood pressure meds. Not to mention, it's about a better outcome, better engagement by that employee in your workforce. I think we just got to think differently. We spend a lot of money, and I'm not sure we get much of a return for it. Okay, so this prompted us. We said, this is no longer just a strategy. This is what it's all about for Fort Healthcare. We are going all in on this issue. So we restated our mission: improve the health and well-being of our community, and our vision is to be the healthiest community in Wisconsin. Okay? Now, we used to have a mission statement, that kind of went something like, we want to be the provider of choice, providing best value care and the highest quality, cost-effective, satisfying, safe, and so forth and so on. And I'm not making fun of that, but that's so inward focused. Okay, and that's part of our problem. We have been way too inward focused. We've insulated the consumer way too much from the true cost of care and the accountability for their care. So now, if I go out and talk to people in the community, are you interested in helping us become I've just engaged the community. I've created a seat at the table for them. It's no longer just up to the hospital to settle and resolve this. So we started going through this process. Okay, if we're going to get serious about this, this is where we believe the future is. What are we going to do? So we ask ourselves these questions: how do we become the healthiest? And how do we change the culture? Love the word culture. We all focus on it with our employees. And again, I didn't talk about employee satisfaction. I talked about patient. I think satisfied employees drive patient satisfaction. That's another topic for another day, but I just want to make mention of that. Okay? Changing the culture within your organization, within your community, I think is where it's at. It's my dream is that people will talk about their health in the future the way they talk about the weather in Wisconsin, the way we talk about the Packers or the Brewers or whatever, but where it is part of your conversation. Hey, where are you working out? Haven't seen you at the gym. Have you been on the new bike trail? What new thing are you eating that's healthy and nutritious? How are you staying current? It can happen. It has to happen. Okay? So just to give you some statistics, that you never set a goal that you can't manage or measure. So these are our county health rankings. And we're like 29th. We're Jefferson County, in Jefferson County, Wisconsin. And these are our statistics. You can go to, you can find your own county health ranking across the country, no matter what state you're from. And you can see we're all measured by these same measures. So I just wanted to share that with you. Morbidity, mortality rankings as well. We have some opportunities, as much as we've got something to build upon. But again, we can go out into the community. How do we know we're not the healthiest? We're right here. Okay? So the triple aim, I talked a little bit about it at the beginning. Improving the health of the population. Our initial focus was reducing inappropriate utilization of our emergency services, and I'm realizing they loaded the different PowerPoint in here. This is a different one that I've done recently, but I'll just flex here a little bit with you. We decided to get serious about improving the health of our population. So we looked at our emergency department. We said there's a lot of inappropriate care going on in our emergency department, focused on primary care utilization. So we looked at that and said, we're going to conquer that, and we're going to try to impact that. It didn't work very well, okay? We had a series of false starts, and we said, you know what, we need to move in a different direction. But something good did come out of that. Our mission is not to improve the health and well-being of those who are fortunate enough to have insurance. It's improve the health and well-being of everybody who's in our community, okay? So we're making a commitment in our community of expanding something we call the Rock River Free Clinic. Okay, it's a Thursday evening voluntary clinic for those people who don't have insurance. We're going to commit a full-time physician, make that investment. We're going to see if we can not only impact people who are most vulnerable showing up in our emergency department, we're going to see if we can increase their access to care. We believe this is one way we can reduce the cost of care. Okay, so we're talking a little bit more about the triple aim. It aligned with our new mission and vision, positive outcomes that we've learned to improve our overall population health. employee wellness. This is a gift that keeps on giving, okay, for you and your employees in your organization. I'll let you read this for a minute. Okay, not only can you help manage the costs of your care, you're going to have a much more engaged employee in your organization, okay? They're going to stay with you longer. This is evidence-based information. This is something that I think is a gift you can give yourself as you set the tone and model the behavior you want for your community. Okay, so I talked about how we're engaging our employees. We've asked a series of questions. Okay, if you're familiar with Turning Point technology, something we ask a question, you can get instant feedback through remote responders. So we ask our employees. You know, this wasn't a show of hands where like the first person stuck their hand up and then the rest kind of followed. This is, you could answer this privately. This is where we are as an organization. I would suggest in healthcare, you're probably in the same spot as well. Okay? So we did a series of surveying. You know, we've gone out and surveyed our community. We've created that baseline. We're going to get serious about this. We're going to measure these goals. We're going to report into the state database and see our rankings and improve. But this is where our feedback, our employees, and I would suggest where your employees are as well, need to set, be the example, be the role model for the rest of the community. Again, I said at the beginning, we need to own this. This is ours. It's not the manufacturers. It's not the service industries. We need to set the example. Okay, so we're trying to lead our employees down a certain path, okay? Setting the culture. We asked, they told us more information. Look at that, 98% saying, you know, yeah, we want to, we're drinking the Kool-Aid. We want to be there with you. We want to make this happen. So more feedback. And another question, as I like to say, if we're going to be the healthiest community, healthiest county in the state of Wisconsin, somebody's got to be the healthiest employer. And you know who that's going to be? That's going to be us. Again, I challenge you, you need to be the ones leading this issue. You need to set the example. You need to pave some of the roads for the others in your community. Okay, so boom, this is what we did in May. Okay, and I'll boil this down for you. Leading our employees where we want them to go, we asked, they told us, we were looking at a 40% premium increase in our insurance. We'd had some bad utilization. We've had some wellness programs, but we've had some false starts with it, kind of more of the voluntary. So we put in place a wellness program, and so the 40% premium increase from $60 to $85, it only went up $10, 10%, excuse me, $8, if you participated in our wellness program, okay? Now, you get a significant premium increase, money in your pocket, and we're also incenting our employees to the tune of $600 a year. And we manage and we mark that off quarterly. So less money out of pocket, a little more money in your pocket. So it amounts to almost $2,000. It's a start for us, okay? But it's this concept, you know, back to, you know, over the course of a year, would you, you know, lose enough weight, you know, if I paid you to do it? I think the answer is yes. So we came up with the kind of, you know, we want to pay people to get healthy and to stay healthy, okay? We call it a benefit, but you only benefit when you're sick, okay? And the people who benefit the most end up costing you the most. So it just seems upside down. It seems backwards. We got to do something different. So we're trying to figure this out. So this is our result. This is just, we just did this in May, you know. I didn't have any union campaigns. I haven't had any organizing or anything like that. I was hoping for 90%. We're at about 85% of our employees participating in this program. And we track it quarterly. It's not, you know, you have to get a certain amount of points. You have to do a health risk assessment, biometric screening that you're probably familiar with. You donate blood, you get a flu shot, you go to your doctor, you do your scheduled mammogram or colonoscopy if you're in that age group and that guideline. There's points associated with that. You got to get a certain amount of points every quarter. If you don't, you get thrown into that higher premium. Because we found in the past people would get all their points in the first month or two, and then they would just coast the rest of the time. So this keeps people engaged. It's changing the culture. It's changing the way we approach, and we got to get greater engagement. So we got to lead. You know, if we do this well within Fort Healthcare, we've now created a model for others out in the community. So that's what we've been doing internally. So now we've gone out, now we've talked a little bit about what are we doing out in the community. And I will tell you the first time I went out and said, hey, I think I can save you money, focus on wellness, and the question was, well, how are you doing with your own employees? Oh, good question. You know, 30% of my employees are overweight. I didn't have a whole lot of credibility. So we went back to the drawing board and said, let's focus on our own population of employees. Again, that whole notion, triple aim. We've got a county, a service area of population, but we have about 1,000 employees. We look at that as a subpopulation, and we think we can learn a lot, we can gain credibility, we can share our story with others out in the community. We can change the culture. The hospital, the largest employers making some differentials in premiums, makes it a little bit easier for others in the community. Okay? So we're looking at who we identify as our partners. It's the faith community, the employers, the school systems, city governments. And so we're trying to meet with them and saying, you know, we understand we're a purchaser of health care. We're a provider, but we're also a purchaser. We hear your pain. We're trying to do something about it. Will you work with us? So one of the things we did is we created a committed to workplace wellness out with our employers. Okay, you're going to say, well, what's that? We went out and we identified some of the employers, especially those who are self-funded, get this. They understand. They've organized, they do health risk assessments, they do biometric screening. They've got senior management committed, they've got wellness committees. So we went out, and we make sure the media is a part of that process, and we say thank you. We want to recognize you for trying to help us fulfill our goal of creating the healthiest community. You're an integral part of that. And so we created an award. We've given away 2 awards. We've got someone else who's saying, hey, what about us? You know, have you looked at our programs and what we've been doing? But I will tell you, one of those employers, this is what is just very encouraging and just funds this whole idea. One of these employers got really behind this and created some incentives for their employees. And 2 employees who were, you know, walking around, thought they were healthy, went and got their colonoscopy, another one got a mammogram, detected stage 1 early cancers, had excellent outcomes because they caught it early. And that's what it's all about. But now this employer is saying, what else can I be doing? This pays for itself. This is how I'm going to fund wage increases for my employees in the future. Okay? We're trying to create some competition, trying to create a culture in our community. Okay? And it makes it easier in this economy for an employer to add an employee if they understand or they begin to tame the cost of health care. And in fact, you might actually get employers over time to relocate to your community if you get good at this and you create a reputation for it. Okay, I've yet to find anybody say, you know what, I don't want to move to that community, they're too healthy. Okay, it doesn't work that way. People want to be a part of this. People understand what it is we're trying to do, but we've just got to get better about organizing and incenting the behavior. So we created a challenge. It's called Rock the Walk. It's a rock river. We're in the process of that. It's kind of a takeoff of the slim down, throw down, slam down, whatever you guys are all participating in. But it's fun, okay? I've got a Fitbit here. It's wireless, Bluetooth enabled. Takes all the hassle out of tracking your points or tracking your steps. Blows right in to my personal health record or my Cerner Health account, and it just tracks my points, okay? So we've started that challenge. We've got 4 employers who are participating with Fort Healthcare. We've got over 600 people. It's a great start. Next time I want to get 8 employers. We'll get a couple thousand people participating. But what does this do for us? You know, it's not all about us, but I think we do have a mission and a vision. But we're trying to help the local employers. We're trying to be a part of the solution. It's a cooperative effort in building a healthy community. I think we can better help them fulfill their goals. As they're fulfilling their goals, I think they'll help us fulfill ours. If you want to have a very fun conversation, go to one of your local employers, managers, senior manager, and look them in the eye and say, next year I want to see fewer of your employees in my hospital. Not because we're denying them access to care, but because they're healthier. Will you help me do this? I guarantee you, you'll get access to their HR director or whoever's managing their benefits. Okay? But it's a different approach. You know, we've grown up in this business. The more we do, the more we make. It's not going to get us where we need to go in the future. Again, the economic times that we're going through, I think this can help prime the pump. We can create these oases of trying to tame this somewhat uncontrollable cost line item for many of our employers. We're trying to come up with the answers for that. And it all started for us because of the triple aim: improving population health, improving our experience of care, and reducing per capita costs. That's the goal. Ask yourself that question on everything that you're starting to do on a go-forward basis. How do we cover more people? How do we spend less money? How do we get a better outcome? Okay, we can go to the interactive. So what this is, and everything I've talked about, and I apologize, there's a little, before I go to this, since I got loaded in a different PowerPoint, we have partnered with Cerner in a way that I think is pretty unique. And I don't need any slides to talk about this. I'll just talk from the heart, okay? A year ago, we were at this meeting, as Brian talked about, and it was pretty exciting. We'd committed to going down this path with Cerner. But we looked at Cerner and said, you know what? We want a different partnership. Fort Healthcare, I'll use the E word here, we're about 30 miles from the epic mega center of the universe, okay? And we looked at their product, and for a lot of reasons, I'd be happy to share those with you, we picked Cerner. Cerner was the right product for us and what we were trying to do. But we said we want to do something different. We don't want just an EMR. We don't want just meaningful use. We want to transform the care. We want to get at how do we manage population health? How do we engage the consumer in a way they've never been engaged? Because we think this is the future, okay? We need better data. We need better clinical information, better operational information, okay? If you remember the golden rule, he who has the gold rules, right? Well, the corollary, I think there's a corollary in healthcare. He who has the data will rule in the future. More importantly, he who has data that's turned into meaningful information will be very, very successful. Cerner got that. They understood that. So we went all in. August 1st, excuse me, August 1st, we went live with our hospital module, our physician module, CPOE, over 50 solutions, 70 solutions. Holy cow. I've got some colleagues. Did anybody call back to the hospital? Are we still good? Are we still open? Of course we are, you know, because they're all here. But it's been a heavy lift. But I think we're trying to do something different. We're trying to find ways to get information to help us better manage what we do. Any successful, you need to know where you make your money and where you spend your money. And up to this point, most of us haven't been very good about that. I think the Cerner EMR will help us all immensely. Now, we were intrigued by Cerner as well. You talk about what they're doing with their associates. We also looked, we're self-funded. We have outsourced as well the management of our health benefits with them. So, and I will tell you that the hassle factor has really been eliminated. I could show you some screenshots, but I would ask you, if you're intrigued, talk to your Cerner associate about, you know, what can you do in terms of managing our medical benefits. It's hassle-free. You go to the pharmacy. If you've done flexible spending, you no longer have to get a receipt, send it in, pay yourself back money that you already had withheld. It's just instantly adjudicated. Okay? That gets more information. We're trying to get the intelligence in one repository for our community. And so that was a second aspect. There's the EMR, there's the pharmacy benefits management as well. Okay. We're also utilizing Cerner for our health and wellness. Again, hassle-free. It shows me exactly where I'm at in terms of my health risk assessment. It tracks my points. I know exactly, it's all on me as an individual if I'm going to pay a higher premium or if I'm not going to get my incentive payment. It's pretty slick, I would tell you. And then the last piece is the personal health record. Cerner's providing that for us as well. And again, but we're trying to, these three pieces of information are so important for us to manage population health. I'm not going to talk about accountable care organization or the patient-centered medical home, other than to say I like the notion of managing populations. I think there's some problems with the language associated with ACOs. It doesn't really work for us and make sense for us, but the concept is still there. Patient-centered medical home is another, that's another topic for another day. But again, the EMR is critical to that. I see great hope, great future for that concept of the patient-centered medical home, being able to manage care and engage the consumer in a way we've never engaged them. So Cerner has been a tremendous partner for Fort Healthcare. We were going down this and we looked at their culture and our culture, where we wanted to go, what we felt they could provide for us. And so far, I couldn't be more delighted with where we are and where I think they're going as an organization and how we can learn from them and they can learn from us. So if you're still with me, so this is a map. This is everything I've talked about, I like to think, is contained in this map, okay? And this is our mission, our vision at the bottom, our values that we aspire to. We named our project the Compass Project, both double meaning in terms of directional, but it's also, it gives us some guidance. And there's a narrative about who it is and what we aspire to be. But these are our partners, what we value, what we stand for. Our service area. There's communities that won't mean anything to you, but they're listed in our area. So we've got about 80 to 100,000 people in our service area. But we're trying to reposition ourselves. We want to be the go-to, the trusted source to drive health in our community. So come here. This is who we call, we're in Jefferson County, so we affectionately call this the Jeffersons. They are a family, and we know that 1 out of the 4 of them is probably obese, and I don't know if it's the child or the parent, but this is kind of representative of our entire community. So you see their dog there, and we hope that they'll walk their dog, and and we see some bikes over here, and we hope that they'll get a little more active. And okay, all right, and maybe the stress that we have in our life, maybe people ought to get out and do a little more fishing and. Okay, we're from Wisconsin, so bear with us. But really, it's just, you got to love it when you can have a mission vision statement that has audio. But really, what this has got all kinds of pop-up features. So this is what we're trying to do. So if you want to go find out what we're doing in our community, in our strategies with the county health department, or events. No, it's not quite working the way I want. But there's pop-up content. This is a work in progress. We're out to share our story with everyone in our service area. I'm glad to share it with all of you as well about what's going to happen. How do we take control? How do we visualize the future? How do we use technology in a way that we've never used it before? We're organizing the faith community, the local employers, the school systems, twofold. what's the content? What are they teaching kids? I'm not in the education business, but we'll certainly try to, influence that. Why do we stop teaching health in 9th grade, for example, in some of our communities? If you don't have your health, I'm not sure you have a whole lot going for yourself. And so, working with employers, the faith community, as I said, county health departments, how do we partner? How do we create a culture of health on a go-forward basis? Okay, we are so inward focused. This is I'm not going to put us out of business, as I showed the obesity slide, but I do believe we can shed expense quicker than the net revenues associated with that expense. Okay, so if I can shed $1 of expense and only 90 cents of net revenue, I've just improved my position, haven't I? And if you look at Medicaid, for most of us, that's a very easy proposition. Medicare, it's probably still pretty easy. You accounting wizards, I'm talking about full count costs. I'm not talking about variable costs or incremental costs and things like that. But almost half of our payers don't even cover their costs. How do we get some of that cost out of the system? Cover more people, spend less money, get a better outcome. They're not mutually exclusive, okay? And I understand, why, well, if it's so simple, why aren't you doing it? Well, we're trying to do it, okay? Why are there so many false starts? Why are we struggling as an industry? Well, there's a lot of people that have done very well off of this broken model. Think doctors, think hospitals, medical device makers, pharmaceutical makers, insurance companies, and I'm not indicting or bashing any of them. I mean, we're trying to undo decades of a system that we've grown up with. And each of them sit at the table accountable, and many times to public entities, public boards, where they've got to represent their best interests. They've got to take the best position that they can. We all agree that we need to change. But we always want someone else to change first. You change first. How's that going to impact me? And I think that's where we've got some of this gridlock right now in our industry. But I think this has always been the business that we've been in, is to provide health and health care. Okay, if we're not out promoting disease and illness so that we can generate more revenue. I mean, we realize how ridiculous that statement is. But why don't we swing the entire different direction? Let's redeploy. Let's focus more on quality improvement instead of quality control. Let's reduce the disease and illness. One of the best ways to eliminate expense in an organization is to not incur it to begin with. Okay? And I think the focus on health in an organization is the way that you can do that. Okay, so I started off with change. And again, I think it's just something you got to continue to lead and bring your employees along. This is a huge opportunity for us as an industry to make a difference. But I think we've got to change to get better.